Hi everyone. Today in this video let us discuss one of the medication Linaclotide. What is this medication Linaclotide? This is one of the drug which can be used for the treatment of constipation that is associated with many of gastrointestinal disorders. Among them, one of the important chronic condition is the irritable bowel syndrome, commonly known as IBS. IBS is associated with many of the symptoms including constipation, which can produce abdominal discomfort, and it is also associated with bloating, fullness of the stomach because of filling of gas within the stomach. Similarly, other symptoms like abdominal pain and flatulence can be observed with irritable bowel syndrome. Among these symptoms, constipation can be treated by linaclotide. Linaclotide is one of the medications which can increase fluid secretion within the lumen, thereby it can increase the GI motility and it can relieve the symptoms of constipation. That's why this medication is used in the conditions like irritable bowel syndrome associated constipation. Similarly, it can be used for other conditions where constipation is associated. So this medication can be used in the conditions like chronic idiopathic constipation. This is a chronic condition observed with decreased GI motility, leading to various symptoms like bloating, fullness of the stomach, loss of appetite, and reduced bowel movements. All these symptoms can be observed in chronic idiopathic constipation, commonly known as CIC. So this condition is again treated by linaclotide because this medication increases fluid secretion, thereby increase the GI motility. And the third clinical use of linaclotide is in the treatment of functional constipation that can be observed in the children as well as in the adults. This constipation results in the decreased bowel movements where less than 3 bowel movements can be observed per week, which results in severe abdominal discomfort, abdominal pain, and bloating. So again, linaclotide can be used to relieve these symptoms, but this medication should be given in the children above 6 years. In this way, whatever may be the clinical disorder, linaclotide can relieve the constipation. So it can be used in the IBS associated constipation, chronic idiopathic constipation, and functional constipation. So today in this video, we are going to discuss how this drug acts, what are the important precautions that should be considered, what are the common and significant side effects, what is the dose. All these things we will discuss in this video. First of all, let us see how this drug acts. Linaclotide can be converted into its metabolite, but this metabolite is also active. So both linaclotide as well as its active metabolite can produce their pharmacological actions. Both of these compounds can act as GCC agonists, guanyl cyclase C receptor agonists. Guanyl cyclase is one of the cleavage enzyme which can convert the GTP into cyclic GMP. So when these receptors are activated, cyclic GMP levels are elevated, which can increase the GI motility. So this is the colon and this is the lumen. Now on the colon membrane, GCC receptors are located. These are the guanyl cyclase C receptors. Now these receptors are targeted by linaclotide. Linaclotide can bind to these GCC receptors as agonist. When these receptors are activated, they can convert the GTP into cyclic GMP, so cyclic GMP levels are elevated within the membrane. This cyclic GMP can target one of the ion channel CFTR, cystic fibrosis transmembrane regulator. This is one type of ion channel which can be activated by phosphorylation. So cyclic GMP can produce a phosphorylation of this target, which is activated and it can allow few of the ions like the chloride ions. Now chloride can be secreted into the lumen. Along with chloride, bicarbonate ions can also be secreted. Now these anions such as chloride and bicarbonate are secreted into the lumen by elevated levels of cyclic GMP within the membrane. Along with these anions, water molecules and sodium ions are also passively secreted into the lumen. Now this results in increased fluid secretion within the lumen, which increases GI motility and it relieves the symptoms of constipation, and even it can reduce the pain associated with the intestinal membrane. In this way, linaclotide can relieve the symptoms of constipation by increasing the fluid secretion, which increase the GI motility. Now let us the precautions of linaclotide. One of the important precautions of this linaclotide is that this drug can increase the GI motility, therefore it can produce one of the condition diarrhea. This is quite common because linaclotide increase the fluid secretion, so it may induce the diarrhea in the patients. But sometimes linaclotide can produce some severe diarrhea resulting in loss of body fluids that may result in various symptoms like dizziness, hypotension, and even syncope, fainting sensation, which are fatal to the patient. That's why any development of severe diarrhea with use of linaclotide should be carefully monitored. If severe diarrhea is developed, then immediately the dose of linaclotide should be stopped and the patient should be rehydrated to restore the body fluids. Another important precaution is that linaclotide is not suitable in the pediatrics, particularly in the children with age less than 2 years. Because in children it can produce severe dehydration, which is highly fatal. That's why linaclotide should not be given in the children less than 2 years. This medication can be used for the treatment of functional constipation in the children above 6 years at lower doses. Now let us see the side effects of linaclotide. One of the important side effects of this medication is the induction of diarrhea. If diarrhea is mild, it is not a significant problem. But in case of severe diarrhea, the patient should be rehydrated and therapy may be stopped temporarily. Similarly, it can also produce other side effects like flatulence, abdominal distension, abdominal pain. Even it can produce headache. And because of increased GI motility, linaclotide can also increase the fecal incontinence and fecal urgency. Apart from these side effects, linaclotide can also produce other side effects like viral gastric infection, sinusitis, cold-like symptoms, and nausea can be produced by this medication. How it is given? Linaclotide is available as a capsule at different strengths starting from 72 microgram, 145 microgram, and 290 microgram. The dose of this medication depends on the type of clinical indication. For the treatment of IBS associated constipation, it can be given at higher doses such as 290 microgram given once daily. But for the treatment of chronic idiopathic constipation CIC, it can be given at half of the dose. That means it can be given at 145 microgram given once daily. Here the dose may be split into two divided doses. It can be given as 72 microgram given twice daily if patient is not tolerating higher doses. Finally, for the treatment of functional constipation, it can be given at still lower doses. So the dose is 72 microgram given once daily. So whatever may be the dose, linaclotide capsule should be taken 30 minutes before the first meal in order to relieve the symptoms of constipation. So that's all about this drug linaclotide. Linaclotide is one of the guanylyl cyclase C receptor agonist. This drug can be used to relieve the symptoms of constipation that may be associated with various clinical conditions like IBS constipation, irritable bowel syndrome associated constipation, CIC chronic idiopathic constipation, and FC functional constipation. Induction of diarrhea is one of the important side effects with use of linaclotide, and in few of the people it can produce severe diarrhea where the patient should be immediately rehydrated in order to prevent any symptoms like hypotension and dizziness. Fecal incontinence and fecal urgency can also be produced by use of linaclotide. So that's all about this medication linaclotide. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.